Hi, I'm Tommy the Vet, and in this short video I'm going to be talking about matching the teat dip to the challenge. So the challenge is mastitis control in our dairy herds, both clinical and subclinical. In my eyes, it really is minimising the levels of bacterial infection the teat's exposed to and maximising the immunity of the cow. The milking routine is one area we really focus on, especially with subclinical mastitis. Working with dairy hygiene specialists has helped me understand the science of teat disinfection. We really can have a huge impact on mastitis control by looking at our teat disinfection. The type of mastitis, the stage of lactation, whether it's freshly calved cows or closer to dry off, the time of year, whether cows are indoors or outdoors, and the harshness of weather conditions. I asked the question, is the teat skin the most important area of skin in the cow? And I say yes, it is. When investigating mastitis, I pay careful attention to teat condition, looking for clues for teat damage and looking for ways to alleviate, repair and maintain that healthy skin on the teeth. I put teat dips into 3 categories, and that's based on viscosity. In simple terms, that's the thickness of the layer of disinfection applied to the skin. The first is the pre and post fast-acting teat dips, which are the thinnest layer. The second is the film-forming agent, or post-teat dip, which is slightly thicker. Lastly, you have the thickest layer, which is the post-barrier teat dip, which you should almost see at the next milking. So what do we actually want the teat dip to do? We want it to kill the bacteria that can cause and spread mastitis in our herds, while also maintaining the health of that teat skin. If we look at the science of hand hygiene, we can learn a lot, because it's that balance between protection and disinfection. And it's all about that balance between kill and kindness to the teat skin. So when applying teat dip, I have 3 rules, the 3 V's I call them. The first one I focus on is volume, that we use the right amount, whether pre-spraying or post-dipping, and just measuring that. And too often I see not enough being used. The second one is visual. Are we covering the teat dip on the teat? The third thing is the viscosity, picking the thickness of the teat dip to suit the challenge, and that's the 3 V's. So when reacting to a mastitis problem, or being proactive in a control program, and looking at milking routine, there's real science to picking the right teat disinfection for your herd. Remember, teat disinfection on its own won't solve the mastitis problem, but it's a huge aid in reducing the risk. So let's try and match the teat dip to the challenge.